Pulmonary hypertension. Pulmonary hypertension is a general term used to describe high blood pressure in the lungs from any cause. Pulmonary arterial hypertension is a chronic medical condition in which narrowed and stiffened arteries cause high blood pressure in the lungs. The heart pumps blood from the right ventricle to the lungs to get oxygen. The pulmonary arteries are blood vessels that carry blood from the right side of the heart to the lungs. In PAH, these blood vessels become scarred and narrowed, leading to reduced blood flow and a buildup of blood pressure in the area. Due to the increased pressure in the blood vessels, the heart is forced to pump harder to supply blood to the lungs. This causes severe damage to the heart, which may often lead to heart failure. Pulmonary hypertension is a rare condition that can affect people of all ages, but it's more common in people who have another heart or lung condition. The blood pressure in the lungs is different from regular blood pressure throughout the body. Having pulmonary arterial hypertension means that you have high blood pressure in the arteries that go from your heart to your lungs. It's different from having regular high blood pressure. You can have normal blood pressure overall but still have pulmonary arterial hypertension. Although there is no cure for some types of pulmonary hypertension, treatment can help reduce symptoms and improve quality of life. Causes. Some common causes of pulmonary hypertension include congenital heart disease, coronary artery disease, high blood pressure, liver disease, blood clots that cause narrowing or a blockage in the pulmonary arteries, chronic lung diseases, exposure to certain drugs or toxins. PAH is about 3 to 5 times more common in women than men. Newborn babies develop a form of PAH is called as persistent pulmonary hypertension of the newborn. It's most common in full-term or post-term babies who experience a difficult birth and can cause rapid breathing or an abnormal bluish skin color. Pulmonary hypertension happens at all ages, including children, and its incidence increases with age. However, idiopathic PAH is more common in younger adults. Other things that can raise the risk of pulmonary hypertension include obesity, usage of illegal drugs like cocaine, a family history of pulmonary hypertension, blood clotting disorders, and exposure to asbestos. Symptoms. The signs and symptoms of pulmonary hypertension develop slowly. You may not notice them for months or even years. Symptoms get worse as the disease progresses. Symptoms include shortness of breath, tiredness, dizziness, chest pain, heart palpitations, swelling in the legs, ankles, feet, and abdomen, bluish color to the skin due to low levels of oxygen in the blood, hypertrophy of the right chamber of the heart. In rare cases of PAH, people may cough up blood or experience a change in their voice. Pulmonary hypertension is classified into 5 groups depending on the cause. Group 1 Pulmonary arterial hypertension refers to increased pressure in the vessels caused by obstruction in the small arteries in the lung for a variety of reasons. These include idiopathic heart problems present at birth, changes in a gene passed down through families, drug related, HIV infection, connective tissue disorders, and others. Group 2 Pulmonary hypertension caused by left sided heart disease. Causes include left sided heart valve diseases such as mitral valve or aortic valve disease, left ventricular systolic and diastolic dysfunction. Group 3 Pulmonary hypertension caused by lung diseases such as COPD, emphysema, pulmonary fibrosis, interstitial and developmental lung diseases. Long-term exposure to high altitudes in people may be at higher risk of pulmonary hypertension. Group 4 Pulmonary hypertension caused by chronic blood clots. Blood clots in the arteries of the lung causes severe pulmonary hypertension. Group 5 Pulmonary hypertension caused unclear multifactorial mechanisms. It could be caused due to blood disorders, metabolic disorders, and systemic disorders. Thank you.